Hey guys!
This week's disease is coronavirus. Coronavirus is an infectious disease that is caused by the SARS-CoV-2 virus, which stands for Severe Respiratory Syndrome Coronavirus 2. The virus first originated in China in 2019 and it was classified as a pandemic in 2020. COVID-19 specifically impacts the respiratory system. Coronavirus is caused when a person is infected with the SARS-CoV-2 virus, as stated above. A person can come in contact with this virus in various ways, since it easily spreads among the population. One of the modes of transmission is close contact. This involves not standing at least 6 feet or 2 meters away from a person that is infected with this disease. This puts someone at a higher risk of contracting the virus. This is due to respiratory droplets that are released when sneezing, talking or coughing from an infected person traveling, and being absorbed by airborne transmission. This is when the aerosols or droplets that are infected are present in the atmosphere for a long time and a person comes in contact with them. This can lead to the disease. The third mode of transmission is when a person comes in contact with an object that has the virus present on it, and then the person touches a portal of entry into the body, which allows the virus to enter and infect them. A portal of entry is a location in the body which allows pathogens to enter, and examples of these portals are the mouth, nose, and eyes.
Once a person is exposed to the virus and infected with it, signs and symptoms appear 2 to 14 days after. Although, this may not happen in all cases since some people may be asymptomatic. When signs and symptoms do appear, they can range from being mild to severe. The severity of them is affected by many factors, and one of these factors is age and having certain medical conditions. Old age and suffering from chronic medical conditions such as chronic kidney disease and chronic obstructive pulmonary disease can put someone at a higher risk for having the severe signs and symptoms of coronavirus since their immune system is weaker. Some signs and symptoms of COVID-19 are shortness of breath, muscle aches, pain in the chest area, headaches, rhinorrhea, which is the medical term for a runny nose, conjunctivitis, which is the medical term for pink eye, nausea, and vomiting. Other signs and symptoms are fever, cough, fatigue, a loss of taste and or smell, sore throat, chills, rashes, and diarrhea. To confirm whether a person has coronavirus, they have to undergo testing. These tests can include collecting a nasopharyngeal swab, which is a nose swab or a throat swab. These swabs are collected through the use of a sterile swab tip that is inserted into the nose or throat and rolled around to collect cells and other biological samples. Once they're collected, these swabs are sent for testing at a lab. If the person getting tested has a cough that is removing sputum from the body, the sputum might also be collected as a sample and sent for testing. Once the test is completed, a person gets their results. A positive result means that somebody has coronavirus, and a negative result means that the person does not have the condition.
There is no cure for COVID, and the FDA has only approved one medication for treating this condition. This medication is Veklury and it is administered for patients in the hospital. Although the FDA has granted emergency use authorization for medications and processes such as Olumiant, baricitinib, specific types of monoclonal antibodies such as bamlanivimab, corticosteroids such as dexamethasone, and convalescent plasma therapy for people who have been diagnosed with this illness and are hospitalized due to it. There are certain things a person can do to relieve their signs and symptoms, such as using pain relievers, using cough medication, getting a good amount of fluid intake to stay hydrated, and getting plenty of rest. Since COVID-19 is an infectious disease, there aren't many pre-existing risk factors that a person can have to contract it. The practices that increase a person's risk of being infected with this virus are being in close contact, which is not 6 feet apart, with someone who is infected with the virus, which can result in inhaling or absorbing respiratory droplets. of the person, which ultimately causes contraction of the virus. As mentioned before, pre-existing conditions can cause a higher severity of symptoms.
There are many things people can do to prevent getting this infection. Some of these are following social distancing guidelines, which means staying 6 feet apart from people, wearing a mask when going out of your house and into the public, washing your hands with soap and water for at least 20 seconds or using a hand sanitizer often, avoiding touching the portals of entry, which as stated before are the eyes, nose, and mouth, covering your mouth and nose when you sneeze or cough and immediately washing your hands after, and cleaning objects that are often touched by people, such as light switches or doorknobs.
Coronavirus is a dangerous disease that is affecting many lives during this time. It is very important that you follow social distancing guidelines and other rules to prevent the spread of this disease.
Thank you for watching the video!
Hit the like button and the notification bell for future updates on videos.
If there's a disease that you want us to do a video on, put it in the comments below.
Bye!